Good morning, all of you. I'm Dr. Mustafa Afzal, working as a clinical microbiologist and infectious disease specialist at Care Hospitals, Nampally. Uh, we have come across recently so many cases of dengue fever now. Like in the last 3 months, we have seen more than 70 to 80 cases of dengue. Though many of them have been like treated on OPD basis and they have not come across any complications, but we thought we'll make a small video regarding this dengue information to the general public. So first, many of us don't know what is dengue. Basically, it is dengue belongs to it is a type of viral infection. First of all, it is not a bacterial infection. It belongs to family flavivirus and order Flaviviridae. Basically, we have many other viruses also in this group, which causes other types of fever like chikungunya, Zika virus, which causes Zika fever, and also we have West Nile fever and tick-borne infections. But today we are going to speak particularly about the dengue fever, which is caused by this virus. Basically, if you see the structure, it has three proteins. The one is an enveloped protein, and the capsid protein, and the membrane protein, which is been outer surface been surrounded by a non-structural proteins, which we called as NS1, NS2, and NS2A and B. It goes on. So this is the basic outline of the structure of the dengue virus. Coming to the life cycle of the mosquito, which causes, which is a vector, which is a factor for transmission, is a female Aedes aegypti mosquito. When this mosquito usually breeds on the fresh waters and it lays eggs on the surface of the water. Once it goes down, it hatches and converts into the larval forms, and thereby this mosquito multiplies very fastly. So when we talk about prevention, we will also discuss about how to prevent this virus being multiplied by proper covering of the waters and all. So anyhow, now coming to the next part about the dengue virus per se. Whenever it that if you see the transmission, it bites the mosquito bites a person who's already infected with the dengue virus, and especially if the person is in a viremic phase, it sucks the blood meal along with that viruses also, and this virus will go into the gut and it multiplies there, and it over a span of nearly 8 to 10 days, this virus may multiply into various multiple small viruses, and which again it gets transmitted to the salivary gland of the Aedes aegypti mosquito. And whenever this mosquito, once it gets infected and it bites the person, so along with this blood, when it starts sucking, it secretes a secretion which will cause seal to the surrounding surfaces, and it transmits this virus through this into the human skin. And once it gets attached to the human skin, from there it invades and goes into the circulatory system and cause the various complications. So this is by and large the life cycle of the Aedes aegypti mosquito and the dengue virus, which is Aedes aegypti mosquitoes which have been infected with the dengue virus. Basically, this virus acts as a vector. Vector is nothing but a transport mechanism for transmitting virus from one area to another, from one human followed by a dengue Aedes aegypti mosquito bite to the another human persons. Coming to the third part, which is very important about the clinical features, if you see. So basically, there are three types of fever in this. One is a dengue fever, which is lasts not more than for 5 to 7 days, and it goes away without any complications. But there are few cases, I would say, out of 100, only one or two cases which may go into the complication, which is called as dengue hemorrhagic fever and also dengue shock syndromes. So nowadays, which we are cases which are saying are mostly are getting well treated within first week of illnesses. They are not progressing to the complications. Very few cases have been progressed to the complications. So basically, one thing we have to understand as a public, general public, it is a self-limiting infection. All viruses are self-limiting infections. It will get treated by itself within 5 to 7 days. There is no need as such for any particular medicine to be taken to treat the disease. I would say like to just to give you more clarity, if we talk about the bacterial infections like tuberculosis or any urinary tract infections by E. coli, it requires a particular antibiotic to kill that particular bacteria. But the same case is not with the viruses. Most of the viruses will die with the immunity of the body, immune system of the body. Coming to the dengue The type 1 where the patient gets well within 5 to 7 days or maximum 10 days, or where the patient will have a high grade fever with a typical orbital pain, a pain in the eyes, and also severe generalized body aches, and also the rashes. Some patient may develop rashes all over the body, and few of these cases may have dehydration. Basically, they have a severe headache, and this is basically due to severe dehydration. So in this case, if you see the class 1, where there are very mild symptoms, where fever of high grade fever and generalized body aches and orbital pain and general joint pains, there doesn't require any particular thing. Just you need to take well, you have to hydrate your body well, take lot of oral fluids, and take any paracetamol tablet. There is no need for any antibiotics, and please avoid ibuprofen or aspirin tablet, especially when you are dealing with a fever which is not of which is of an unknown origin. So these cases, most of them will become all right within 5 to 7 days or max 10 days. Just you need to take a rest, good hydration, and proper like the supportive treatment. Like suppose if you have a fever, you can take paracetamol tablet and all. Coming to the second part, where comes about the category dengue shock syndrome or dengue hemorrhagic fever, which proceeds to the complications. Usually this happens in very 1 to 2% of the overall dengue cases, where they may have different systems get involved in the body. So basically, if you see the pathology, what happens in the dengue is there is a capillary leakage will be there, and the fluids will get leaked from the vessels and goes into the third space, and patient will have typical hypotension with a high hematocrit, which suggestive of dehydration. So you have to correct this patient IV with the IV fluids, and make sure that you should not overload the fluids when you are treating the dengue patient, because there are chances due to the capillary leakage, fluids may get deposited into the third space and cause pericardial or pleural effusions and tamponade, and subsequently patient may die also. And the complicated cases may also involve, apart from this capillary leakage and high hematocrit, they may involve respiratory systems, leading to sometime breathlessness, and they may require oxygen supplementation, and very few cases, I would say, unless they get secondary infected, will proceed for the mechanical ventilation. Third cases where the common system get involved is your acute kidney injury. Sometime patient may have, it may be due to prerenal azotemia, or it may be due to sometime dehydration, where the kidney insult may happen. And apart from that, there is hepatitis may happen, where the liver enzymes, especially OT and PT, SGOT and SGPT, may get deranged, and patient may have viral hepatitis like picture with a pleural effusion and ascites. So these are the few complications, and very few patients may further proceed to the neurological complications, and sometimes the patient may have even a psychological thing due to the overstress and all. So this is what, like dengue hemorrhage syndrome, patient may go into the shock with a hypotension and bleed, hemorrhagic bleed inside, and this may lead to complications. So whenever you have a fever with any bleeding is there from bleeding per rectum, when you are passing stool there is a blood, or there is bleeding from the nose, or bleeding from any other areas, like if you are having hematemesis, vomiting with the blood in the vomitings, then you have to get admitted, and you have to take proper treatment. And here where the platelet counts comes to the picture, and the platelet counts will be done, and based on the platelet counts, the FFPs and PRPs may be given to the patient. One more myth I want to remove from the public is that please don't go for the platelet transfusion immediately unless your doctor advises. Usually it happens that even if you can wait up to the platelet of 20,000 to 10,000, if there is no bleed, just you have to take a rest, and the warning signs which would say we have to keep in observation the warning signs. If you have any bleeding from any site, or if you have low BP, or if you are having vomiting of the blood, then immediately you have to get admitted and get properly treated. Regarding the platelets, when it has to be given, that proper like a clinician can decide based on your platelet counts and the bleeding tendencies. Rather, what I would say, in our practice we would wait up to 20,000. Also, if there is no bleeding, we can wait and watch. Unnecessary platelet transfusions or FFP transfusion is not needed. And I've seen many doctors giving antibiotics in the dengue fever. They are writing sulfapurazine, sulbactam, doxycycline, whatnot, everything they are writing. Please avoid antibiotics. You are adding further insult to the already existing infections in the body. More the antibiotics, more your normal bacterial flora will get killed, and your immune system will get weakened, and there are chances that you may land up in some other complications. So you, as a patient, you should say doctors very clearly, there is no need of antibiotic. unless if there is any secondary bacterial infection is there, or something where bacterial infection is there, there is no need of any antibiotics. Just take fluids orally, take fluids orally, and also take rest, and take supportive treatment in the form of paracetamol or any other medicines. This is in short about the dengue complication. Coming to the diagnostic aspects of the dengue fever, we have a few area of investigations like dengue NS1 antigen test and dengue IgG and IgM test. Usually many hospitals are doing CAR test, which we call as immunochromatography. NS1 antigen test will come positive in first 48 to 72 hours, and IgM will come positive after 3 to 4 days usually, and it remains positive for 2 weeks. And the IgG will come positive after 4 weeks, and it remains positive for 1 month. Apart from that, we also have ELISA method, enzyme linked immunosorbent assay investigation for this NS1 IgG and IgM test, and also few places they also do dengue PCR test. Coming to the treatment part, as of now, the dengue vaccine is still under trial. In USA, there are certain areas where dengue is epidemic they are giving, but in India it has not been started till now, and there is no rule of vaccine as such in the Indian scenarios right now. The treatment, as I said you, there is no particular antibiotic or no particular antiviral has to be given in dengue fever. Only bed rest with a good hydration and keeping eye on the warning signs which we have discussed just now. That is more important. To the preventive aspect, we have to make sure that both indoor and outdoor places we have to take proper precautions. Like in indoor, you use mosquito repellents, and also mosquito nets to be covered. The windows and the doors shall be covered with the mosquito nets, and make sure that the kids wear long sleeve clothes and trousers. Coming to the outdoor part, we have to cover all the utensils which are being kept outside, because this may be a place for breeding of the mosquitoes. So this is in short about the preventive aspect, and thank you so much for listening my video patiently.